I'm Doug Abel, Vice President of Public Affairs and Communications for Harris County Medical Society. Welcome to the first episode of our Artificial Intelligence in Medicine series. Today, we will be discussing the benefits of AI in your practice. I'm joined by Dr. Eddie Patton, a neurologist here in Houston who's been practicing for about 15 years and who's been using AI in his practice since about 2020. Welcome, Dr. Patton.
Thank you, Doug. Thanks for having me.
You're very welcome. So with this increasing technology of AI and the widespread use that we're seeing in a number of industries, a lot of our members are interested in the applications that AI has in their practice and in healthcare. Some of them are very intrigued by it, and some of them are very trepidatious about it. So as someone who has been using AI and been exposed to a number of different applications, what are some of the benefits that you can tell us about AI in a medical practice?
Sure. Well, first of all, it's not a question of if you'll be using AI, but when and how you'll be using AI. A lot of physicians are using artificial intelligence or augmented intelligence, and they either don't even know it or don't realize that they're using AI. So we're seeing widespread applications, everything from scribing and to the billing process as well, to more advanced technologies that deal with diagnosing and reading radiological films. So it's a fast-paced topic as we go through the evolution of AI in healthcare, but it's one in which we need to be on the forefront because, again, it's not a matter of when, it's how I'm going to be using it in my practice.
Very interesting. So I think one of the big questions that people may have is, how to use this as a way to improve some of the administrative functions. So for example, what can you tell us about the use of AI in filing insurance claims?
Yeah. So the process of filing insurance claims can sometimes be a very mundane process. And when you think of artificial intelligence or software that can help you with scrubbing charts or looking at denials and why there are denials and hopefully help you cut through the red tape, this can make the process of filing insurance claims easier, more efficient, and hopefully reduce the number of denials for a practice. So that's one example of how advances in artificial intelligence can help your practice when it comes to filing insurance claims, to reduce the number of denials, and to reduce the amount of administrative burden to you as a physician or to your staff.
Very good. What are some of the other benefits or some of the other applications that you've seen that could be applicable immediately to a practice?
Sure. One of the big things that I'll talk about and that I do see in practices across the state and across the nation that have already started to incorporate artificial intelligence is when it comes to the scribing process. How do you document the visits? So we have software now that's available, that's on the market, that will help you to transcribe your visit into a note that is good enough for the insurance companies to reimburse you, and that has everything that you're in it, and that has all the documentation that you need for that visit. And what this will allow you as a physician to do is to be able to spend more time with your patient, more face-to-face time, which is really what we want. We want more face-to-face time, and any technology or software, artificial intelligence that will allow us to engage our patients more and not have to worry so much about the documentation piece. That to me is an exciting advancement and one that I know it's in practice. I've used and think is a pretty good way of using artificial intelligence.
That's great information. And it's also a good reminder to always check for the accuracy whenever you're using an AI product, right? So
yeah.
AI should be a tool for physicians to use, but never a substitute for a physician's medical judgment.
Yeah, absolutely. I would agree 100%. Even when you talk about artificial intelligence for diagnosing and radiological imaging and so forth, it's still imperative that we document, that we verify as well, and we use it to help our practice and not, replace what we do.
Very good. Well, thank you so much for your time, Dr. Patton. That's all the time that we have for this first episode in our AI in Medicine series. Until next time.